Hi, welcome to MHT. My name is Erica. I'm the Director of Corporate Education here at Home Office in McKinney, Texas. What I want to go over is a pretty brief presentation about who we are, what we do, and why we do it. Now, the context of this is twofold. One is to give you an understanding of the question, what do you do for a living, when people ask that of you? I also want you to be armed with this information in the back of your head so that when you're talking to potential referral sources or even patients, you know where the roots were of this corporation. You know where we came from and what our core values are. With Medical Home Team, we are a medical management company. The vision that was kind of seen back in the day by our owners and founders, Scott and Judy Postal, was to provide a superior medical experience for seniors. They recognized right off the bat that that community, the geriatric population, was very underserviced, especially when it came to healthcare. And that helped kind of roll into our mission statement, which is, as you can see, exponential. It is to care for and nurture seniors, one patient, one home, one family, one community at a time. And just like our company has grown, the concept of how we care for our seniors also grows, starting with the patient, patient-centered care and evidence-based practice, growing that enthusiasm to care for the patient throughout the household, throughout the family, wherever they might be located in the States, and then the community, even people not directly related to that patient, need to care for and nurture those patients. Throughout our home office, throughout our text that we hand out to you as new employees, you're going to see our core values listed in this mnemonic. It, of course, spells seniors. The important part to note here is that these values, the sincerity, the integrity, the responsiveness, don't just apply to external customer service, the way that we treat our patients. It also applies to the way that we treat each other. So please take these to heart and remember that we are going to give you this much care and consideration as we expect you to give to our seniors. So what was the problem? What was the birth of Medical Home Team? What did we try to solve by creating this company? As you know, right now, Medicare is one of the lower reimbursing insurance companies out there. It starts with primary care. Primary care is in a bit of a pickle. You see, they have all these patients to see, but they need to keep the lights on. No one likes to talk about medicine and money combined, but the fact is, if a primary care physician is running a business, they've got staff to pay for as well as products to pay for. They've got overhead, and seeing one patient with multiple chronic conditions for hours at a time just doesn't pay as well as seeing multiple younger acute care patients. So the format that we're all very used to was born. We call a patient, or we call a primary care doctor when there's a problem. We wait for something to go wrong. We go in for 10 or 15 minutes and wait for them to fix just that one thing. And usually the conclusion of that appointment is them saying, if anything else goes wrong, give me a call. We've been chasing our tails medically. Now, for younger and acute patients with sinus infections and allergies, that format still works. But for our clients, the elderly population who have multiple chronic conditions, who have the chance to exacerbate and go to the hospital, that format doesn't work. That's forced them to supplement their care because they can't sit with their doctor for hours at a time. They've had to go to urgent care clinics and go to the emergency room, sometimes causing admits, and sometimes causing a very big financial strain on the Medicare system. Now, one of the ways that we can prevent that is through Medical Home Team. Medical Home Team's brainchild was to pair a nurse practitioner with a supervising physician. That supervising physician would still be in charge of that patient. They would still have them in their patient base, but we were moving the complex patient away from their schedule, freeing up that time for them to see those younger acute care patients with private pay insurances. Now, this worked very, very well. This has been tried and true for a long time. The patients can stay at home. They don't need to go to urgent cares or go to the emergency room. We're able to handle their care head to toe and make sure that they don't decline. We're able to establish baselines on those patients from their home where they're comfortable, where they don't have to sit in a waiting room with a bunch of other sick people, where they don't have to get out in the extreme weather or the heat or the snow. Now, The teams that we had originally launched consisted of that primary care provider along with a nurse practitioner and a care coordinator. All three of them made up the care team, and for a long time they were very self-sufficient. The nurse practitioner was in charge of making sure the patient received all the care they needed, as well as any auxiliary care, reaching out to people who could do diagnostics, home health, ordering durable medical equipment for them. And so it went. Medical Home Team was born and launched under the premise that we need to provide this care for those people in the elderly community. We were going to do things right, straight from the get-go. We were going to document everything and make sure that we were doing things based on evidence, not just drumming up appointments for the sake of drumming them up. The primary directive that we have to provide that patient with superior experience became the #1 thing that we want to make sure is our patients are receiving. Our satisfaction scores need to be above 90%. That means we are patient driven. For the first time, this community has someone who's got their back. Now, we were able to extract information about these care teams and come up with a plan for those care teams to be able to be productive, seeing a certain number of patients every day, bringing in a total number of patients into a practice. And the care teams were born and launched, and they flourished. We have, since we were started years ago, reached out into multiple cities and multiple states, and we now have different types of care teams that can provide for this senior community. One of the more exciting developments that we've reached is being asked to be a member of Medicare's ACO. Now, that's an accountable care organization, and that's a whole other topic unto itself. But I will share with you that the benefits of being in an ACO is that they're an umbrella for us for patient care. They are quality control. They make sure that we are minding our P's and Q's, that we are sharing in the savings that they benefit from, and that we are treating our patients with dignity and respect using evidence-based practice. They also do that for any of the auxiliary teams that we might want to share the care of those patients with. Because of this new development, the launch of our ACO accreditation, we are now able to combine all of the quality care for our patients. Patient-centered care, not just from the nurse practitioner and the primary care physician, but also all of the people caring for that patient. There's no more disconnected, unorganized medical care. We're very proud of this development at Medical Home Team, and because of that, we feel that we really hit the mark. We are now able to keep patients in their home where they're comfortable. The supervising physicians are still very involved in their care, but they can run their business the way that they need to in order to be productive. And we've got a community of patients who no longer feel neglected thanks to Medical Home Team. On behalf of Medical Home Team, I want to thank you for your attentiveness and also welcome you to our team. It's important to know that you are joining something that is growing, and we are really going to be doing the most benefit for our patients. When people ask me what I do for a living, even though I'm no longer involved in face-to-face patient care, I tell them that I keep elderly people out of the emergency room. And I like that, and I hope you like that too.